1, 2, 3. I was feeling so bad. I asked my family doctor just what I had. I said, doctor.
Hello, I hope you're great today. If I haven't met you yet, I'm Dr. Blahnik, and I want to say welcome to our office and thank you for visiting us. We are so grateful you are here. Please let us know how we can help you. The majority of our patients, perhaps like you sitting there right now, are referred here by other family members and friends. Perhaps that's you. Even by other doctors, medical doctors, chiropractors, physical therapists, other types of doctors. And the reason that they trust us enough to refer you in or send you here is because we are highly committed and actually received awards and honors for excellence in patient care. We get results. And so the other reason they trust us enough is because they know that we are going to commit to teaching you and educating you about your health, what's going on with your body. We get to the cause, we want to correct the cause, identify the cause, and minimize the symptoms. We don't just treat symptoms, we look to correct the cause. So what I want to do is I want to make sure you know exactly what to expect from this appointment today, because I do know this. I mean, after a decade in practice, there's patients, people maybe just like you, that really have an excellent high-level understanding of your nerve system and your spine. You've seen other doctors, other chiropractors. You may be even visiting them now. So there's people that know a lot. They got PhDs in this stuff. And then there's people that really don't know anything, and there's a lot of in between. So what we want to do is we want to catch you up to speed so that we can meet somewhere in the middle once we get to know you. So we also know this, that trust doesn't happen in one day. It's not going to happen in a 15 to 20 minute visit. That's going to be built over time. So just understand that. We know trust is built over time. So no matter how you got here, whether it was actually online, you found us online from Facebook, Google, one of our positive reviews, again, somebody maybe referred you in. It doesn't matter how you got here. I just want you to know what to expect today, because there's always 2 appointments for any new patient. The first appointment today is really it's kind of the investigative side of things. So if you kind of think of like maybe going to a dentist and you say, well, you know, I got a pain in my tooth, how much is it going to cost? They have to open your mouth, take a look around, maybe do some x-rays, then they're going to be able to say, hey, here's what we found and this is what we need to do. And essentially that's what we're going to do with you today. Today we're going to do some exams, some biostructural exams, some biofunctional exams, some things to see, is there damage or interference to your nerve system? If there's indicators for that, we're going to use very advanced technologies, even imaging studies, to detect and determine if there's damage, deterioration, degenerative disease, scoliosis, something interfering with your God-given health potential. And so to start, what we're going to do is we're going to just start some biostructural exams, some simple biofunctional exams to see if there's indicators of that. And then what we're going to do is we're going to do some imaging studies, because we don't really like to guess, we want to test. Your spine and your nerve system is the thing that actually controls every body biological function, and we wouldn't touch you in terms of working with you unless we knew and saw exactly what that looks like. You can kind of think of it like this. Would you ever allow somebody to do brain surgery on you without actually looking at an MRI or some type of imaging study? You wouldn't. Well, your brain controls all functions in your body, so let's discuss that. God put the most amazing power in your brain and nerve system. So that information, that healing power, that life in your brain, that is the thing that if you do this, go ahead and wiggle your toes or wiggle your fingers, that's what makes that happen. Your nerve system allows the function of muscles, your arms and legs, but it also controls all body functions. So for your eyes to see, for your heart to beat, for your lungs to breathe correctly, for you to hear me or even interpret my words, for your digestive system to function, for your bowel, bladder, reproductive organs to function, all that is controlled by your nervous system. So the power that's flowing through the nerves. And that power is not blood. So blood doesn't flow through the nerve systems. It's kind of like electricity. It's that what we just call the life and function, the power God put in your body to heal, which means this. If you were to, let's say, cut your arm, you have this amazing healing power in your body to heal a cut. In fact, even if you broke a bone, thank God we have these amazing practitioners that can set the bone, but the healing power is within you to heal the bone. So even a broken bone. So why aren't you healing? We want to figure out what is interfering with your maximum healing potential. And that's why we have to look at the nerve system. So because if we were to do this, let's just say, if we were to take a scissors and cut the nerve to your eyeball, how quickly would you lose your vision? It would be instantaneously. If you severed that nerve to your eyeball, you would not be able to see. So the power is off, or there's no function at all. And so nobody's running around with scissors, but what we do is we can put damaging pressure, interference on a nerve and not even know what's happening. So that's why we need to investigate that further. We need to test and not guess. Because if you were to choke a nerve, let's just say you were to choke a nerve going, let's say, to your thyroid gland. It's a gland that produces hormones for energy, for metabolism. But let's say that we're choking and pinching, putting endangering tension and stress on a nerve to your thyroid gland. What would that do to the function and health of your gland or your hormones? Yeah, it's going to decrease it. So you're decreasing the function, and then over time what that does is that builds disease. So all symptoms are, whether it's an ache or pain, headaches, a digestive condition, a hormone imbalance, a spasm, muscles tingling, muscles spasming, tingling or numbness running into your legs or arms or hands. Those symptoms, you can think of those like warning signs. That's the check engine light on the car telling you that there's a malfunction. And so let's just look at that as like your car. So your check engine light's on your car, what do? The worst thing you could do is just put duct tape over the check engine light. And that is a lot of what we do in healthcare today. We begin to mask the symptoms primarily with medications today, or some type of prescription or over-the-counter medication. And that's what leading us into the crisis of painkiller deaths, the opioid crisis, because you're not really correcting the cause, just masking the symptoms. Things continue to deteriorate, so you need more of what? More of those things. And so what we want to do is we want to get to the cause of it, identify it, correct the cause, and make sure you're well for life. Not just feeling good, but functioning good. That's a huge, important distinction and difference. If you get nothing else from this, just understand this. You could feel sitting there right now absolutely normal. You could feel absolutely healthy. No pains, no aches, no symptoms at all. Does that mean you are healthy though? Feeling good doesn't mean healthy. Again, that's why we test, we don't guess. Why doesn't feeling good mean you're healthy? Well, look at heart disease. Heart disease kills over half the population right now, and the majority of which have no symptoms, they have no pain. So you're not feeling the disease in your heart building for 5, 10, 15, 20 years. Think of like cancer. When do most people find out they have cancer, a terminal disease? Typically not until it's end stages. So just because you might be sitting there feeling good doesn't mean things are functioning normal. That's why doctors want to do exams. They want to check your blood pressure to make sure there's not something going wrong underneath that you can't even feel. So the most important thing to be looking at is what we consider to be the missing link. And the missing link to your health and your wellness and your ability to thrive in life is really your nervous system. What is your brain, your spinal cord, and your nerves? That's these little tentacle things that come out of the spine. What is your brain, spinal cord, and nervous system, your central nervous system? What does that have to do with your health? And if that was being damaged, what part of your body would that affect? That's what we're going to determine.
Your central nervous system is made up of your brain and spinal cord and is continually monitoring and coordinating every single function in your body. If you think of the brain as a central computer that controls and coordinates all the functions of your body, Then the nervous system is like a communication network that relays messages back and forth from the brain to different parts of the body via the spinal cord. The spinal cord is a long bundle of nerve tissue which extends from the lower part of your brain down through your spinal column. Along the way, smaller braids branch off from the cord and pass out from the spine between each of the movable vertebrae. These braids divide again and again into tiny nerve fibres and fill the entire body, going to each cell, organ and tissue, sending and receiving messages through the spinal cord. Now, our nervous system is extremely delicate, so what protects it? Our spine. This is what a normal healthy spine looks like. It has 24 movable vertebrae, each working with the one above and below it. A disc separates the vertebrae and acts like a shock absorber and a spacer for the nerve. So why is a healthy spine so important? Well, it protects the spinal cord and the delicate nerve tissue and allows us to bend, flex, twist and move freely without compromising the nerves. If the spine is not moving freely, it's referred to as a vertebral subluxation complex, or for short, a subluxation. Is that right? Subluxation. Is there another word we can use for that? No? Okay. This is when two or more vertebrae have lost their normal motion and or position. This can cause interruption to the normal nerve flow and interfere with the communication from the brain to the body and from the body back to the brain. Research at the University of Colorado found that it only took between 8 to 10 millimeters of mercury pressure to reduce the nerve supply by up to 60%. That's about the weight of a small coin. Compression can exist without pain, so that means where the nerve goes to can be robbed of up to 60% of its nerve supply and you may not even feel it. This is what is referred to as a silent subluxation. So what happens when you have a subluxation? That area can start to degenerate in as little as 2 weeks. This degeneration causes scar tissue to develop, which leads to more scar tissue. This degenerative process can continue as long as the immobilization is present, and this type of degeneration is preventable. Spinal degeneration has nothing to do with how old you are. You can be 60 years old and have a perfectly healthy spine, or you can be 10 and have a spine that's already showing signs of degeneration. It all depends on how and when the subluxation occurred. If the nerve supply to anywhere in the body is disturbed, it can eventually lead to a symptom. Symptoms are the only way for your body to let you know that something's wrong. So let's go back to the same spine again. If you have nerve interference in the cervical spine, it can lead to headaches, migraines, lowered immune system, sinus troubles, hay fever, abnormal sleep patterns, eczema, hearing loss, tonsillitis, chronic cough, croup, pins and needles into the arms and hands. In the thoracic spine, asthma, functional heart problems, bronchitis, influenza, gallbladder troubles, liver conditions, blood pressure problems, indigestion, heartburn, gastritis, lowered immunity, allergies, kidney troubles, chronic tiredness. In the lower back, constipation, menstrual problems, bedwetting, knee problems, sciatica, backache, poor circulation, swollen ankles, weakness into legs and cramping. Wow, I'm out of breath. And that's naming only a few. Did you know that less than 10% of your nervous system perceives pain? So quite often, by the time pain and symptoms appear, the nerve interference could have been present for months or even years. Think about when a person has a heart attack or a stroke. They don't actually feel the arteries blocking up and usually don't know anything's wrong until it's too late. Painkillers and anti-inflammatories can cover up the symptoms, but they don't get to the cause of the problem. By masking these symptoms, it allows the problem to continue to develop silently until there's a major health crisis. We all know about the damaging side effects that can occur from long-term drug use. So why continue filling your body with drugs to hide the cause of the problem? Now you might be wondering what causes subluxations to occur. Gardening, sports, computer work, pregnancy, improper lifting, arguments, food additives, chemicals, birth, poor posture, to name but a few. There can also be mental causes, such as stress. The average 5-year-old has had approximately 2,000 falls, of which 200 are considered serious. But usually an isolated event alone is not to blame. It's an accumulation of many of life's little incidents and accidents. Recent research has found that in births that required intervention by a doctor, which means they used forceps, suction or excessive force, 95% had upper neck injuries. So it's a smart decision to have your child assessed at an early age. Locate and correct spinal interference so your nervous system can perform at its own optimal level. Remember, the immobilized area will degenerate at a faster rate than the area with good balance and movement. Fortunately, with the right care and by mobilizing these areas and creating good alignment, the body can begin to slow, stabilize or reverse the degenerative process. Assist the healing process by re-establishing the nerve flow to its optimum level. This allows the proper communication between the brain and the body. Don't treat the symptoms. Rather, they remove the nerve interference, which allows the body to do what it does best, heal itself. When you get a cut or a broken bone, who heals it? Your body does. All forms of the healing arts have their place, and let's face it, medicine has an important role to play in crisis and emergency care, and in these situations can be life-saving. On the other hand, by removing nerve interference and allowing the body to heal itself. So for health, wellness and quality of life...
So I know you value your health, otherwise you probably wouldn't have made an appointment to see us today. So what we want to know is what concerns you most about your health, not just where you hurt, or even if you don't hurt, what is your biggest or greatest health concern? We want to be able to discuss that, and you might have not thought of that issue when you made this appointment. In fact, I've seen thousands of patients throughout the year. Often some people don't even want to check the boxes in terms of the things they are suffering with, as if they're trying to secretly, not want to tell you or something. Listen, I get it. I've seen you before. It won't be the first time and it won't be the last time. But wouldn't you want to know, let's just say, wouldn't you want to know if you had a tumor? You would, because then you could do something about it. So even if you're silently suffering, you don't want to explain all of that, we get it. Listen, I get it. I've seen enough people to know that, and there's reasons you have for that. But if we can identify that you are damaging and interfering with that power that brings life and function to your organs, what would that be worth to you? What would that be worth to know that you are creating malfunction, you are building disease silently, and you couldn't even feel it? What would that be worth? That's what we're going to do today. So muscular issues, we tend to think of those as simple issues, will help you quickly. Now, if you have a shift, a misalignment, a subluxation, that's a concern because now you're damaging and interfering with the nerve system. What part of the body is that's going to go to? Wouldn't you want to know if that was happening with you? So that's a concern, and we would express that to you. We would let you know we are concerned. Simple issue, muscular issue, we'll let you know, hey, go ahead and make your next appointment when it's convenient. We're going to help you as soon as possible. But if we find something a little bit more significant, like a subluxation, we're going to let you know we're concerned, and we want to see you at one of our first available appointments. Worse, we see an advanced degenerative disease, scoliosis. There's not a month that goes by when we're not talking to somebody about their cancer or whether they knew they had it or didn't have it. If we see something more of a concern, we're going to let you know we're highly concerned. We want to see you right away. We'll make a first available appointment. We'll even give you a doctor's release, a work release to make that appointment. We think it's that important. In fact, so just like this, what we're going to have you do is we're going to have you watch another video similar to this, but this next video is going to be more about what you're going to see on your imaging studies, your x-rays, what to be looking for. Essentially, it's the basics. What you want to see, what you don't want to see with your spine and your nerve system. So when we look at your imaging studies, you're going to make sense of it. So that's what that video is going to be about. More general health information. It's going to be different than this, but you will be watching that video, and then we're going to show you your imaging studies. So that intro video as well as that next appointment is going to be your most important appointment. We're going to cover exactly what we found, what the concerns would be. our recommendation, so whether it's something simple like you could do at home to help yourself, exercises, physical therapy, rehab, we will recommend the best options. If it's something more significant, maybe we need to refer you to the right doctor or therapist. We will not hesitate to do that. We'll get you into the right hands. If we feel like you're in the right place and we can help you, we'll let you know that too. Most people, by the time they're here, they already know they want our help. And so what we're going to go through at that next appointment is then, okay, what does care look like? What would we actually be doing to help you? Everybody's got questions about cost. Does my insurance contribute? Do we take insurance? We're going to, whether you have insurance or don't have insurance, we have a care plan that is affordable for any budget. But previous to your next appointment, we want to verify your benefits based on what we found today. And so we're going to do that on your behalf if you make sure you give us your insurance information, accurate information, so we would be able to identify what your benefits cover, whether they contribute or not. No matter what the outcome is, at your next appointment, we're going to show you how you will be able to afford care in our office. We do not turn people away because of money. We will figure out a way for you to get the help you need. So that second appointment is critical. It's important. I would say it's a bit lengthy, kind of like this one. The first couple of visits in most clinics are the more lengthy ones because we have to get a lot established, and then it'll go easy from there. So it is, I'll apologize. It's a lengthy appointment, but it is a critical appointment. That's why, again, if you need that second set of eyes, a second set of ears, bring your spouse. Show them what's going on. Let us show them your x-rays. And because here's why. If my wife, let's just say my wife, my beautiful wife Lisa, who's here, if my wife Lisa went to some doctor and they had identified some condition, or worse, a degenerative condition, and she was asked to review that, what I know is she's going to want to talk to me about it. And in fact, if some doctor talked to her about a degenerative condition or some issue going on in her body, I would want to be the first one to ask questions to the doctor. I would want to see it. I would want to ask questions. So don't expect that significant other or even spouse to get it unless they're looking at it with you. So again, if we recommend you bring your spouse, there's a reason for that. We've identified something. We want them to see it with you. The other part of that is this, though. People don't even know they have a condition, a wicked scoliosis, a severe scoliosis, an advanced degenerative disease, and now they know they want care. Maybe they didn't know they needed care or wanted care initially, and now they want it, they need it. Now they have to go talk to their spouse. Maybe it's a payment option plan. So I got to talk to my spouse about the payment. Again, that's why they should be here, so that you can collectively look at it, you can have that discussion, and you can determine, so we don't have to do your next appointment twice. So we would have to repeat your next appointment. That will save us time. It will save you time in the office if that person comes with you. Again, things do not go away, and we want you to trust us enough that we have your best interests in mind. We would not recommend that if we didn't think it was important. We have your best interests in mind, which is why we have 2 appointments for every patient. Some people, and maybe it's you, they expect everything in 15 minutes. That's not what we do here. What we do is, we're going to do imaging studies. We're going to take the time when the office is closed, when we can concentrate on your imaging studies. We're going to read it, and we're going to make our notes, and we're not going to rush through something. That's when important little details are missed. Important things, significant things are missed when people are rushed. So we don't want to be rushed, and we don't want to rush you. So that's why every patient gets 2 appointments in your best interest. So once we've had time to look at your case, study your case, get recommendations together, we'll have you back for that next appointment, and you can begin care at that point, provided we're on the same page. So again, there's 2 appointments for every patient, no matter how you got here. The first appointment, it's kind of the boring day. You got to fill out the paperwork. You got to talk to us. We're going to do some exams, and then we're going to set up that next appointment. That next appointment, you're going to watch that next video teaching you more about what x-rays should look like, what they shouldn't look like, We're going to show you your imaging studies. We're going to go over what we found, and we're going to give you recommendations. So that's that next appointment. And again, we're going to go over care plans and how we have financing options. We turn no one away because of money issues. If you want help, you're in the right place. And again, if you need to bring your spouse, we will provide you with a work release for you or them or both. That next appointment is important. So let's not proceed if you're not serious about that next appointment. There's not a fee for that second appointment. You can kind of think of that as that's just part of this first appointment. So there's 2 appointments. That second appointment, there's no fee for that second appointment. That's part of your opportunity here today. But that is the most important appointment, and that's when we're going to decide if we're going to be working together, if we can help you. But it all begins with the power and function of your nervous system. Again, what is your brain, spinal cord, and nerves, those little tentacle things reaching out from your spine, what do they do for the function and health of your life and your future? Let's get started. So go ahead and crack the door when you're ready. That'll let us know that you're ready, and we'll get started, and we're going to set up that next appointment when it's right for you. God bless, and I hope you have a great day. Let's get started. So go ahead and crack the door when you're ready. That'll let us know that you're ready, and we'll get started, and we're going to set up that next appointment when it's right for you. God bless, and I hope you have a great day. Let's get started. So go ahead and crack the door when you're ready. That'll let us know that you're ready, and we'll get started, and we're going to set up that next appointment when it's right for you. God bless, and I hope you have a great day.
Tonight, we begin a week-long series looking at the opioid epidemic, a serious issue around the country. The CDC says each day, 91 people die from overdoses. 91. Senior correspondent Rick Leventhal tells us where we are right now and the surprising way this country got here.
On any given day, the Warwick, Rhode Island Fire Department's Rescue 1 rolls on a dozen calls. Traffic accidents are routine, and so are overdoses on opioids like heroin, fentanyl, and oxycodone.
And we spray this up into the nostril.
Rescue Lieutenant Henrik Dunleavy shows one of the methods for administering Narcan, a life-saving drug for opioid OD. He's seen a dramatic uptick in addict rescue calls in his 17 years on the job, and sometimes saves the same people over and over again.
They're this close to dying, and then you get them back with Narcan, and they're awake, and they're talking, and they're like, oh, no, I didn't do anything, and then finally they admit, oh, I was doing heroin. Okay, well, don't do that again. And then, like, next week you come back, and there they are again. And you hit them again when I can get back. I'm like, what are you doing?
The worst drug-induced epidemic in U.S. history.
Bertha Madras is a neuroscientist on President Trump's opioid task force. She says the crisis traces its origins to a pair of studies in the 1980s, including this one in the New England Journal of Medicine, which declared addiction was rare for patients treated with narcotics. Pharmaceutical companies launched aggressive campaigns promoting powerful meds like Vicodin and OxyContin. There was movement to name pain as the 5th vital sign, and physicians began writing hundreds of millions of prescriptions based on what Madras calls poor science.
Nobody had done long-term studies on treating chronic pain with opioids. There was nothing in the literature.
You can't overstate the pressures that were put on young physicians in the late 80s and early 90s to treat pain, not just adequately, but aggressively treat pain.
Dr. Michael Dacey is the president and COO of Rhode Island's Kent Hospital. 3 ODs arrived by ambulance in the hour or so we were there, 2 more the next day. Dr. Dacey says the medical community was misled, but it shares responsibility for this deadly scourge.
You had a combination of people fervently trying to do the right thing at the same time as these more potent, newer forms of narcotics like OxyContin came along that were marketed initially as being not as addictive. Turns out they were at least as addictive. So you had this perfect storm coming together, and as physicians, we own a piece of this.
In upstate New York, the opioid epidemic forced Syracuse Behavioral Health Care to dramatically expand its facility.
We serve a couple of hundred patients. Now we're serving over 900. And that isn't enough. We're literally bursting at the seams.
The opiate treatment program distributes methadone and other drugs through dosing windows with nurses and counselors on duty around the clock. Because CEO Jeremy Klemansky says if addicts don't get immediate treatment, they will die.
We don't debate whether or not someone with chest pain would likely die if they didn't get into an emergency room. We don't debate whether a diabetic left untreated would really die of their diabetes and when. But for some reason in this sector of healthcare, sometimes there are people who want to debate those things. And the reality is the debate is over.
The number of people who die in the U.S. from drug overdoses every year is staggering. 52,000 in 2015. That's more than car crashes and gun homicides combined. In fact, opioids alone kill 91 Americans every single day.
The pain that pill caused me is a trillion times worse than any pain I would have endured, I'm sure. Go on.
Nathan Wendelowski got hooked on Oxy after surgery and eventually moved on to heroin, in and out of rehab for 10 years.
Why didn't it work? Why the first time, the second time?
I didn't think I could do it. I just kind of was like, I loved it. It was my everything. I loved it more than my family, more than my job, more than my friends, more than my girlfriend at the time.
He's been sober 4 months and says the substance abuse program at Butler Hospital saved his life.
How do you know that you're not going to go back again?
I take it one day at a time.
Yeah.
And I see people dying all around me, people very close.
Yeah.
I have more people died that I know than I have fingers and toes.
Right before I left, the nurse or the receptionist said, "Ooh, honey, wait. I bet you're in pain. Let me have the doctor write you a prescription." And I'm like, a prescription for what?
Danielle Amaral says she got hooked when she was still a teenager after she went to the dentist to get her wisdom teeth pulled. Years of abuse later, she's taking another drug, Suboxone, which cuts her craving for Oxy and helps her live a sober life.
You think of addiction, you think of like a street drug and crack houses and scary places, and it's not. It's not. They're everyday people like that had no idea.
Nathan carries a clipping of a lost friend as a reminder of what could happen to him. There will likely be at least 50,000 similar obituaries this year. In Providence, Rhode Island, Rick Leventhal, Fox News.